Megan, how are you today?
I'm good, how are you?
Good. My name is Cammi. I'm an advanced practice nursing student at Aurora University. And this is Megan. She's a 25-year-old female with type 1 diabetes, and she's been getting monthly checkups by her primary care provider. Today she's here for another checkup. A few weeks ago she had a hypoglycemic event and suffered a fall, and she injured her right knee. So Megan, what brings you in today besides your checkup? Anything in particular?
My right knee's been bothering me since the fall.
That's it?
Mm-hmm.
Okay. Well, we're going to do a thorough head-to-toe assessment. If anything feels abnormal, if you have any pain or discomfort, just let me know.
Okay.
Okay? Okay. Have you had any head trauma recently? Any headaches?
No.
Any seizures?
Mm-mm.
When you fell and hurt your knee, did you hit your head?
No.
Okay. I'm just going to look first here at your head and inspect here for any abnormalities, for any lumps, bumps, any scars, any bruises or moles. Everything looks good. Do you wear sunscreen when you're out in the sun?
Yes.
Okay. Next we're going to go on to your face, and I'm going to palpate your sinuses. So I'm going to start with your frontal sinuses here and palpate any pain or pressure.
Nope.
Your ethmoid sinuses, your maxillary sinuses. How do those feel?
They feel fine.
Feel okay?
Yep, no tenderness.
Okay. Next I'm going to test your facial cranial nerve. I'm going to take this piece of gauze. What I want you to do is close your eyes, and when you feel it touch your face, tell me where it's touching your face at.
Okay. My right forehead. My left cheek. My chin.
Perfect. Okay, so that nerve's intact. Everything looks as it should. Have you had any problems with grinding your teeth?
No.
Any TMJ or TMD problems?
No.
Okay. I'm going to palpate your TMJ and just feel here. Open your mouth and close it, and open it and close it. Okay, I don't feel any grinding or clicks, so that feels totally normal. Any pain with that?
Nope.
No. Okay. Next, I'm going to look at your eyes. I want you to close your eyes. I'm just going to inspect your lacrimal glands and your tear ducts here. Any pain or discomfort with that?
Nope.
No. Okay. Have you had any drainage coming from your eyes?
No.
Okay, I'm going to have you just look normally. Pull down here, look up a little bit. Your conjunctiva is nice and normal. No pinkness, no redness. Everything looks good there. Okay. All right. Do you wear glasses or contacts?
No.
Okay. And have you seen your eye doctor recently?
Yep, about 3 months ago.
Okay. So since you are diabetic, it's important to have regular routine eye exams. We're just going to do a visual acuity test here to test, make sure things are all okay. I'm going to hold this. You can look forward. Hold this about 14 inches out from your face. And I want you to just close or cover one eye and then read the bottom line.
WPIC.
Okay. And now cover the other eye and read the bottom line backwards.
PCIW.
Okay, perfect. So that shows 2020, so your current prescription is up to date and everything looks good with that. Okay? Okay, I'm going to now look into your eyes. I'm just going to look at your optic nerve and into your blood vessels. You can just look straight ahead. Okay, I can see your optic nerve, it's intact, and your blood vessels look good. I'm just going to come over here and look at this eye. Okay, everything looks good there. Okay, I'm going to do a peripheral vision test just to check your optic nerve in a different way. So I'm going to come behind you, and I want you to tell me when you can see my finger.
Now.
Okay, and again.
Now.
And last time. everything's intact. Okay, I'm going to use this light again, and I'm just going to shine it on your tip of your nose. So just look forward, and I'm just going to shine it here and check your corneal reflex, and I can see that the light shines in both eyes at the same spot, so that is very normal. Another test we could do to test your corneal reflex would be to use this piece of gauze, touch it to your cornea, and do some blink. It's kind of uncomfortable, so we're not going to do it since everything else seems to be pretty okay.
Thank you.
Okay. All right, so we're going to move on to your ears. Have you had any problems with your ears lately? Any drainage?
No.
Any pain? Any infections?
No.
Any loss of hearing? Okay, so I'm just going to inspect your ears and see how they look. I'm going to palpate them. Do you need pain?
Nope.
Okay. Looks good. I'm just going to look inside of them with this light. Okay. Looks good. This is your tympanic membrane. It's a gray, pearly color. A little bit of cerumen. That's normal. And the same over here. Membrane's a gray pearly color, and the cerumen's present. That's just fine. Okay, I'm going to do a test to test your acoustic nerve. So I'm going to go behind you. I'm going to whisper some things, and I want you to tell me what I'm saying. Okay?
936.
Okay.
WP3.
Perfect. Your acoustic nerve is functioning well. All right. Now we're going to move on to your nose. Have you had any problems with a runny nose? Any allergies?
Nope.
Any stuffy nose?
Nope.
Congestion? Okay. So I'm just going to look at it and inspect it. I'm going to palpate it for any abnormalities. No bony abnormalities there. I want you to plug one nostril and take a breath up through the free nostril. Okay, and then do the same with the other side. Okay, any difference in airflow? Do you notice any changes between the two sides?
Nope. They're both pretty clear.
Okay, so that indicates a normal septum, no deviation. Have you ever had any facial trauma?
No.
Keeping the nose?
No.
Okay, sounds good. All right. So next we're going to test your olfactory nerve, and this is the nerve that helps with smell. So I want you to close your eyes. I want you to tell me what you smell when I wave this in front of your nose.
Oh, alcohol.
Yep, that's right. Very good. Okay, sorry to shock you like that. Okay, and I'm just going to look into your nose now with this little scope. And look up. Good. I don't see any lesions or any little massings or anything. Okay, looks good. I'm going to move on to your mouth. Have you had any sore throats lately?
No.
Okay, I want you to first smile for me and frown. And then purse your lips and blow through them. Good. And then puff your cheeks out like a chipmunk. And then don't let me push them in. Okay, good. Now I want you to stick your tongue out. And then I want you to push your tongue up against both sides of your cheeks. That's testing your, okay, hypoglossal nerve. Perfect. Okay, very good. And then another way to test when your nerves, your vagus nerve would be to induce a gag reflex. What I'm not going to do because it's kind of mean, would be to use the tongue depressor to touch your uvula on the back, which we're not going to do. So
Okay.
I'm just going to look in there now and inspect things. Tongue out. And okay, uvula's midline, everything looks good. There's no redness, there's no inflammation, there's no exudate. I see your tonsils are still intact, so that's good. Any canker sores lately?
Nope.
And do you see a dentist on a regular basis?
Yes, every
Okay.
6 months.
Good. Keep that up as well as your eye exams.
Okay.
Okay, next we're going to move on to your neck, and I'm going to palpate your lymph nodes. Okay, so I'm going to start here with your preauricular lymph nodes, and your postauricular lymph nodes, and your occipital, and your tonsillar, and your submandibular, mental. Okay, everything looks good, feels good. I was assessing for size and tenderness. Any pain with that?
Nope.
Very good. Okay, and then I want you to look up to the ceiling. Your trachea looks midline. No deviations present, so that's very normal. Okay, I want you to shrug your shoulders and push up with my arms. Perfect. That's intact. And now I want you to push against my hand and push against this hand, and then tilt your head against my hand, and again. Good. Any problems with neck stiffness or neck pain?
Nope.
No, okay. So next we're going to do the thoracic area. I've been watching you through the exam. You're breathing normally, your rate is normal, your rhythm is normal. So I'm just going to listen now to your lungs. Any history of pneumonia?
No.
Any history of coughing?
No.
Okay, I'm gonna first go to the side here and inspect you for any barrel chestedness. I don't see that. And looking at your eyes for any protrusion to indicate a thyroid problem. I don't see that. I'm just gonna listen to your lungs now. Deep breath. Okay. Again. Good. I'm gonna come into the back and do the same. Deep breath. Again. Again. Good. I hear clear lung sounds in all lung fields in both sides, so that's a good sign. I'm next going to check your chest expansion to measure that to see if it's symmetrical. I'm going to put my hands back here. I want you to take a big deep breath in. Good. And my hands, what they did was spread apart equally to indicate symmetrical chest expansion, so there no collapsed lung. Both your lungs are working equally. That's good. And next I'm going to test for vibrations on your chest wall to see if I can feel them equally. I want you to say the word 99.
99.
Again.
99.
And again.
99.
Good. That was equal on both sides. Okay, and then I'm going to do some percussion on your chest wall. Okay, I'm going to go back and do the same. Okay. No abnormalities there. Okay, I'm going to assess your heart. Any chest pain recently?
Nope.
No dizziness, lightheadedness?
Nope.
Okay, I'm going to look at your hands and check for cyanosis, which is a blue color, and I don't see any. And check your capillary refill, which is less than 3 seconds. Also check your toes. Less than 3 seconds, so that's good. Good circulation. Okay, I'm going to look for JVD. Neck, I don't see that. And I'm going to check your carotid pulse, which is nice and strong. That's good. I'm going to listen to your heart now. Just breathe normally. Your aortic valve. harmonic veil, second harmonic, twist it, your right triplet. Okay. Everything sounds good, a regular rate and a regular rhythm. Any pain or discomfort with that?
Nope.
Okay, and then I'm going to check your pulses. Start with your brachial pulse. Pull out your arms. Check here. And your radial pulse. I'm going to check your femoral pulse up here. Okay, and your post-popliteal, your posterior tibial, and your dorsalis pedis. And they're all 2+, which is very normal. Okay, we're going to move on to your abdomen, your belly. Have you had any nausea, any vomiting,
No.
diarrhea,
Mm-mm.
constipation, any reflux?
Nope.
Okay.
Healthy in that department.
Good. Okay, so I'm going to first, I'm going to have you lay down, flat. I'm going to come over here on this side, and first I'm just going to look at you, and I'm going to see if everything looks symmetrical, if there's any distension, if there's any bulging. Have you ever had a hernia?
Mm-mm.
No. Okay.
Nope.
Belly is nice and flat, and everything looks good. And so next I'm going to percuss your belly for tympanic sounds. Okay. Everything sounds as it should, so that's good. And I'm just going to listen for vowel sounds in all quadrants. Good. You have vowel sounds equal and active in all quadrants. You can go ahead and sit up again. So the last thing we're going to move on to is your musculoskeletal system. Okay. So I want you to sit like you are. Do you have any dizziness?
Mm-mm.
Not lightheaded?
Nope.
Okay. So I want you to stand up, please. And I want you to walk just kind of in the line just so I can see you, how you move, your hips are equal, your gait's steady, no pain, no tremors. You feel okay?
Yep.
Okay.
Feels good.
You can sit back down now. Okay, and then we're just going to test some of your rotation, your range of motion type things.
Okay.
So if you want to lay down.
Sure.
And I want you to cross your legs over each other. Okay, and then kind of pull your legs together. Cross them, and then pull them together. Okay, so that's your abduction. And then I want you to separate them apart and pull them apart. Okay, that's abduction. And then I want you to take your right leg, take your right foot to your left knee. Has internal rotation. Any pain with that?
Nope.
I know your knee was bothering you. It's
Yeah.
still okay?
Yeah.
Okay.
It's a little sore, but it's not severe.
Okay. But I see your range of motion is okay, so that's good.
Mm-hmm.
And then take your right knee to your left knee. I know it's there.
Okay.
Is that painful? That's external rotation. Looks okay. You're able to do that pretty alright. Okay.
Yep.
So then it'll do the next leg. Take your left leg, left foot to right knee. Okay, that's good. Then we'll do the left knee to the right knee. This part, it seems weird. Okay, good. Yes, external rotation. That looks good. Okay, you can sit back up again.
You were explaining it well. I just wasn't following
No,
directions.
it seems backwards. It's weird. Okay, so now I want you to do your arms. I want you to cross like this in front of you for adduction, and then move them away like this. abduction, and then I want you to put them behind your neck, or internal rotation, and then behind your back. Okay? Any pain or discomfort?
Nope, feels pretty good.
Okay? And then put your hands in front of you, palms down, and then same motion, moving straight back. Any pain?
No.
Okay. Looks good. Well, everything checks out pretty okay, head to toe. All your systems are normal. That right knee I know is bothering a little bit. I think we'll just do an orthopedic evaluation of that, and I'll prescribe you an anti-inflammatory and see if that works. And I'll see you back in the office in about a month.
Okay, sounds good.
Okay.
All right, thank you so much.
Mhm.